Cerebrospinal trauma and closed chest trauma, and there is a closed right femoral fracture. So his blood pressure is 160, pulse is 124, respiration is 28, that is high, and 2 hours after the skeleton traction was performed under the topical lidocaine anesthesia. So there is a skeleton interaction has been performed. The patient condition suddenly became the worst, and his face and neck became the cyanotic. Blood pressure dropped, that is 60 to 40, and heart rate 160. It's too high. Respiration rate is, let's say, tachypnea condition. What complication has likely developed in this patient? So this was the favorite question in the KROK-1 as well. If you just have discussed with the previous batch here, like whenever there is a trauma associated, trauma induced or trauma associated complication, that is always and always fat emboli. So no doubt the correct answer is here, fat pulmonary embolism. But how to just like this is the like a trauma associated, there is a like complication, that is always fat, it is a keyword. But now let's look for the explanation. The patient is having cerebrocranial trauma, chest trauma, and closed femoral fracture. Overall, the blood pressure dropped from 100 to like 60. So next, okay, so here in the given condition there is skeletal traction. So BP dropped from 100 to, so it is a hypotension all in sudden, and there is a tachypnea condition, and there is a like cyanotic acute, like there is a hypoxia condition is also, and there is a heart rate. So tachypnea, tachycardia, everything is like associated. Obviously it is a complication. So because of there was a trauma, and trauma induced, they always leads to the fat formation in the blood circulation, and it leads to the embolism. Now why it is embolism? Because when we do the surgeries, so there is a 90% time there is a fat droplets which go throughout the circulatory system, and that leads to do some sort of complications with our central nervous system. Pain shock, myocardial infarction, pulmonary embolism. Actually it is a pulmonary embolism, but if there would have been only pulmonary embolism, then this was the answer. But there is a more specific fact is given, so that is what is a fat pulmonary embolism. This all I have explained many time in my classes, in my previous videos, so you can go and watch it. I'll not waste your time here again. So just this keyword will lead you to select the correct answer.